So varicose veins is very common. It's seen about 20 to 25%. And the thinner veins that you see a lot of people, women especially, have it on the legs. Those thinner veins seen in up to 40% of them. So it's a very common problem. If you ask me, it's more common than cataract for the eyes and stuff. And what happens is the blood does not flow properly, and the blood from the legs is supposed to go to the heart. Instead, it comes back down in the legs. That's varicose veins. It's a very common problem, right from early stages where it looks very ugly and disfiguring, to advanced stages where it causes ulcers, clots, and the clots can sometimes migrate to the heart. So it causes various types of problems. So there are many types of symptoms. Very late stages, only advanced final stages, does it form ulcers. Okay? So sometimes in earlier stages, you have leg pains, leg cramps, leg discoloration, becoming black, ulcer formation. And then in some cases, you just see this network of spider veins. That is also very bothersome, and that's a problem. Very few hospitals that are set up only for vascular surgery and varicose veins. In India, we are the first. We are the largest varicose vein center and a hospital pan-India. And of course, there are many stages for the first stage is when the veins are barely visible, and second stage is when the veins are more visible, which is reddish, blackish in color. Third stage is when it starts causing symptoms. It's basically leg pain, leg swelling, reddish veins around, and that's called third stage.
Okay.
In the fourth stage, the leg becomes black, so the skin below the knees black. And the fifth stage we call pre-ulcer stage. It becomes black and small छोटे ulcers in forehead. And last stage we get big ulcers. So right from first stage to sixth, we have treatments that are very, very different from each other. We cannot give same treatment for C6 patient, which is last stage, versus C2 patient, which is second stage. So we'll have to have different kinds of equipment, expertise. So a large corporate hospital where they do heart surgery, brain surgery, some other kidney stones and all, they don't have focus in treating these veins end to end. It requires specialized vascular centers. We have the only one in India that can do it. Absolutely different. So the skill set, the doctor's ability, the equipment is all very different from first stage, early stage, final stage. I'll show you each one of this equipment, how we operate them, but basically requires some planning and right. So it can happen in any age group, but the youngest patient I've seen is 15 years old. The oldest is 96 years old. But most often we see it in women after 25 years. So between 25 to 60 years, women constitute almost 60 to 70% of the patients. So it's common in women of all age groups. So without telling you more about it, I can actually demonstrate how these machines work, why we are the best, why we have the best equipment. We do 3 different stages of varicose. Okay? Yeah. So I'll briefly explain the process of varicose veins for you. Okay? So we have what's called as a deep vein. The deep veins is inside the muscles. Now, blood is supposed to go up in the deep vein like this. Same way, we have what's called as a superficial vein, and that is just under the skin. Veins like this. In that also, blood has to go up. What is happening for you in varicose veins is the valve here. This valve is not working. So blood goes up and then comes down. So I'll put abnormal blood as red. Okay? So the blood is just coming down. So it's not going to the heart, it's coming down. When it comes down and it comes all the way to the foot, you get black color and foot discoloration. But sometimes it may come and go through the branches, and it will show up like multiple spider veins under the skin. So depending on what we're treating, we should have a different strategy. So if suppose we're treating for ulcer, we can just fix this vein
do an endovascular procedure, fix it, then the ulcer will heal. But suppose patient is coming with ugly legs and she's not able to wear short skirts or clothes, or he or even anybody feels very embarrassed when you have veins all over, then what we can do is we may fix this only up to here and then do little specialized injections from outside with laser therapy, and that's called as plaques. If you do that, then this whole veins get repaired, and for that you need specialized equipment. And to my knowledge, there are only two centers that do plaques in India, and we are the third center. So it should be a specialized center that can only deal with these specialized veins. Only then will the success rate be good. So the principle behind doing a good varicose vein surgery or any venous surgery is to have your own ultrasound center. You should do your own machines. You have your own machines. Now, I notice a lot of doctors will send you outside for a scan. Invariably in the diagnostic center, they get a very bad report because they don't know the refluxing patterns. They don't know the individual anatomy. A lot of them don't have patients to make the patient stand. See, they're doing the position patient in the standing position. 99% of diagnostic centers don't have the patients to make the patient stand up. So almost all the time, if you've gone to a varicose center and the doctor is referring you to another center to perform the scan, you're wrong. Now what we do is, because we're India's largest venous center, we have this latest state-of-the-art QG machine with a 26-inch monitor that can help us see every small vein that I showed you about. So all of Avis patients, all of us are scanned using our own proprietary scanning machine, and we do it here, and all the scans, all the color Dopplers are free, and they're done in the world's best state-of-the-art machines. This is the most important step in diagnosing and therefore being able to treat varicose veins. Smallest of veins are very, very well seen in this latest QG machine that we have. So now what we do basically is to identify, first you need to have a very high quality equipment like the ultrasound that we saw before, and now we also require a thing called as vein viewer. So this is an augmented reality kind of a viewer. So what this helps us is to identify these abnormal veins. So when I see an abnormal vein, I take this white marker and I mark it like this. Okay, so all these veins are marked out. And then once I finish marking them, see these beautiful veins? Normally you would not see them so clearly, but because these veins are marked by me, I'm going to be able to mark them out, and then we're able to perform the procedure. Okay? Now this vein is marked here. So I'm going to show you the new CLACS technique. In the CLACS technique, we have three things. This is a cryo engine that delivers cold air. This is a laser that we use to burn the veins. And post doing the laser, we'll be doing a small injection into that to completely eliminate the vein. By doing this, we have more than 98% success. Normally, if you do only skin level lasers, you have only 38 to 50% success. So it's a very successful and a very efficient procedure in decreasing the skin veins and beautifying your legs. So this is called as endovenous radiofrequency ablator. So basically this is the 7 centimeters. This is of 7 centimeters length. So what we do is this is for those bigger veins that I was talking about. In that, we put this vein into this catheter into the vein like this, and this is the 7 centimeter burning zone, and the back of this is connected to this machine, and we pull 7 centimeters at a time and burn the vein. The entire vein is burnt in less than 3 minutes, and there's no cutting, no stitching, no anesthesia. In modern days, no one should go for an open surgery where all the veins are cut open and removed. That is absolutely no go. So for the bigger veins that slide down your leg, we have this endovenous radiofrequency ablator. For smaller veins, I just showed you about a CLACS procedure that takes care of your entire veins. So we have the entire armamentarium. So when you go to your next vein clinic, you should ask, do they do their own scan? Do they verify the scan findings with every patient of theirs? Do they have the entire armamentarium, radiofrequency and glue and other equipment? Do they have the entire equipment for CLACS procedure to perform all the superficial veins? You should go to only centers that are holistic and can treat your entire problem from end to end.